With that, I am going to introduce our first presenter tonight, Brittany Hawkins, who's the founder and CEO of ELANZA Wellness. So Brittany, if you want to go ahead and share your presentation, and I'll turn it over to you.
As you mentioned, I'm Brittany Hawkins, the co-founder of ELANZA Wellness. And after undergoing fertility treatment myself and writing a book about it alongside 25 fertility doctors, I know how much fertility coaching can dramatically improve the patient experience and improve clinical care. Despite the explosive growth in assisted reproduction, there are still some significant gaps in care. Firstly, there is no emotional support, which is really unfortunate if you consider that 90% of people undergoing treatment have depression and anxiety. And then on the other side of the coin, there are some really important lifestyle modifications that people are not told about currently that could actually increase success rates by 27%. Now, because of the lack of education and support, studies have shown that 30% of patients drop out of treatment, which accounts for about $3.7 million in lost revenue per doctor per annum. The existing tools focused on fertility are mostly just tracking and Q&A-based apps, most of which are not founded in clinical evidence, nor do they integrate with clinical care. So that's why we've created ELANZA. Patients receive psychology-driven coaching, data-driven step-by-step insights, and their own fertility coach to help guide them throughout the journey. For clinics, our pilot shows that we can reduce dropout rates by 50%, adding an additional $2 million in revenue per doctor per annum. And by giving patients evidence-based information and insights outside the clinic, we're able to give 12% of that crucial time back to the clinical staff, increasing their throughput. Lastly, by having access to qualified human coaches, we're able to help patients navigate through the most challenging aspects of the journey, keeping them on track and motivated to continue their treatment protocol. So to kick off the journey, each person has a one-on-one onboarding session with their assigned coach. This is really important because it establishes the connection and accountability as well as support with the person in order to drive that long-term engagement and commitment to the program. After this session, the coach then determines the best next steps for that person based on their unique needs. At the beginning of the journey, we really focus on lifestyle and environmental aspects of fertility, which come from the most current body of evidence. These cover off on nutrition, sleep, exercise, environmental toxins to avoid, and more. They are all delivered digitally in the form of daily nudges, diaries, and the use of behavioral economics with things like gamification. This really helps people feel like they're gaining crucial momentum and progressing towards their fertility goals. So once the person has built a foundation of knowledge, they receive weekly check-ins with their coach. This is delivered either through text or voice. These short sessions are really important because the coach can capture really sensitive information, things like if the person has had a miscarriage or potentially a failed cycle. They can also help the coach guide the person onto the next digital module. This is all built around the fundamentals of cognitive behavioral therapy, which is a very well-established approach for fertility. Then the journey culminates in the empowerment of whole patient care that can actually improve outcomes. For example, a Belgian study with 260 couples starting IVF found that pretreatment nutrition and exercise interventions led to a 27% increase in success rates. But this really only scratches the surface. After conducting our own meta-analysis on the breadth of lifestyle factors, we've developed our own fully integrated approach to improving outcomes. That's why we're in negotiations right now with NYU and Stanford to conduct randomized controlled trials on how our proprietary coaching platform can actually improve the outcome and the experience of fertility care. From the very beginning, we have taken this clinic-centered, evidence-based approach, working with some of the country's top fertility doctors to co-develop this technology platform. Our pre-consultation pilot was distributed via 11 clinics, which validated our hypothesis that digital coaching would reduce attrition rates, with 50% of patients more likely to continue with treatment after participation. Then in June of 2021, we were one of 10 companies selected from a pool of 50,000 applicants to participate in Techstars New York, which is an accelerator program, during which we raised $275,000 in pre-seed funding. We're currently focused on launching our full coaching platform, inclusive of asynchronous digital content, as well as the human coaches. This is distributed through our current clinic partners, for which we're charging $85 per person per month. Having this clinical validation will really segue into our employer pilots that we have in place to launch by the end of this year. This also increases our addressable market to about $24 billion. Then throughout this process, we've been in discussions with Anthem to ensure that the platform is in compliance with the CPT code for coaching. So to do this, we have got exactly the right skills and experience to make it happen. Amongst us, we founded 4 companies in mobile, tech, and fertility. Our combined skills in research, marketing, law, fertility, and tech are going to be really crucial in making what is a very cold and clinical process into one that is both more empowering and much more successful. Join us in taking the fear out of fertility.
Dr. Eisenberg, I don't know if you'd like to start off with some questions for Brittany. And again, just a reminder to everyone, if you have questions for Brittany, please put them in the Q&A tab, which is right next to the chat.
Yeah, I can get us started with the question. I know there are, many apps out there already that support fertility health, and you talked about, the CBT. Can you just explain a little bit more about how ELANZA is different from existing apps? And, do you have any data to suggest it's more effective, or where do you think that kind of differentiation lies?
Well, so there are many apps in the App Store currently that are focused on fertility. They're mostly around, period tracking or kind of tracking the growth of your pregnancy. But we're really taking this kind of both in person with the coaches and then online with digital kind of support approach, which is sort of synchronous and asynchronous. And we found that combination, it really keeps people engaged on a more daily basis. The other thing is that with apps right now, we actually had an app once and scrapped it because we found that there's already this sort of app fatigue. And often when people are going through what is a really challenging emotional process, they're not actively seeking out a specific piece of information within an app. That's why we've taken a sort of multi-platform approach in which they receive, maybe it's a daily nudge via text message, or it's a phone call, a FaceTime with their HIPAA compliant, everything's HIPAA compliant, or maybe it's a voice call with their doctor, with their coach. It really depends on what we're trying to achieve, and then building it around the user.
And a related question in the Q&A now is just wondering about the lifespan of that coaching relationship, kind of as things get going, and then also if there is a birth or a miscarriage, kind of what happens after those events.
Yeah, I mean your reproductive lifespan is long, right? So we find that people are most in dire need of this sort of coaching when they're actually seeking out, to become pregnant during the sort of fertility process. However, absolutely, we want to expand both backwards and forwards. There's a lot that we can do coaching for things like PCOS, endometriosis, fibroids, but then also continuing exactly as you mentioned into first year of life and beyond.
And another question coming through is, is this really specifically focused around people seeking assisted reproduction, or it sounds like it's versatile enough that you could, support anyone who's seeking fertility? And you mentioned a number of other clinical scenarios. Can you speak to kind of that initial focus?
Yeah, absolutely. We're really, we have a sort of our initial focus is going to be assisted reproduction. That's mostly because we have really established relationships with clinics already. But this is absolutely something with the employer strategy. It's anyone who's even considering getting pregnant, or maybe they don't even know if they want to be pregnant. A lot of what we're trying to do is empower the person to not only get a baseline level of knowledge around the sort of lifestyle and environmental pieces, and then give them the tools, the emotional support to actually make decisions that work best for them.
Great. As a PCP, I certainly do this kind of thing every day. So I certainly know patients appreciate that support. You mentioned this employer-focused strategy. Can you talk about that strategy as compared to a direct-to-consumer strategy, and relatedly what the revenue model would be?
Yeah, I've launched apps before, and the B2C model is very much, I would call it a spray and pray. It's really hard to gain any true traction when you're talking about just sort of living on the App Store. It's really important for us to have a true clinical background. We want to be a sort of adjunct to your clinical care. We don't want to replace it. We really want to be in support of it. So for us, having that initial go-to-market through clinics and then integration with employers allows us to not only have it paid for by the employer, but it's just a much quicker way to get to market with exactly the right target audience at the right time.
Okay, so this would be an employer-sponsored benefit that someone might receive?
Exactly. I should have continued on that. So we're looking at charging roughly $85 per person per month. It's called PEPM, per employee per month, and it would be on a seat usage basis. And what we're actually looking at, we've gotten a ton of interest from employers, specifically because fertility benefits is becoming this really important benefit that actually employees are looking for when they're seeking out new jobs. So there's kind of two tranches that we're looking at. One is if businesses that already offer fertility coverage, that's things like, coverage for IVF or egg freezing. But 90% of those people have depression and anxiety. So the actual management of the process, which is where the real impact, comes down to the employer. That's things like absenteeism, presenteeism, and actually acute healthcare needs that usually come in line with depression, anxiety. So that's where we can actually be a sort of addition to their existing fertility benefits. But then on the other side, there's a lot of small to mid-sized businesses that cannot afford the full spectrum of fertility coverage. So we can actually expand far beyond that and give, sort of those small to mid-sized businesses, as well as people who live in what I would call fertility deserts around the US. People who don't have readily available access to fertility clinics or OBGYNs. So we can actually help them manage that process, and that would live, whether or not you have fertility coverage.
So there's a lot of different scenarios where someone could access your content or your coaching. Mm-hmm. And can you talk more about your intellectual property protections and your approach in that area?
Well, in this area of digital health, it is really hard to have, proper IP coverage. It has a lot to do with, establishing our unique paradigm, which is this, I showed you the chart before, really covering off on environmental, lifestyle, mental health, and emotional. This is our USP. And a lot of it comes down to brand integration and having this unique paradigm. Okay,
and one other question, you mentioned having 11 pilot sites. What have you learned from that about working with fertility clinics and how to integrate more effectively with clinical care and serve those needs?
We learned so much. It was actually a really great experience working with them. We found that, it's behavior change is actually quite simple. The biggest benefit for the least amount of friction in which to get to accomplish that. So we found that making it as turnkey as possible for the clinic, having it be streamlined as basically a link that goes into the onboarding document for the patient before they arrive in the clinic. Anything that doesn't require more training or any sort of extra effort on behalf of the clinic. As I mentioned before, we're trying to help them be more efficient, not actually add more to their workload. So that was really important to understand the nuances of how each clinic works and what that intake process looks like, and even seeing where the challenges might be if we were to do it differently.
I can absolutely second that we cannot handle one more thing in my clinic. So I know if someone wants us to do something, it has to be, absolutely seamless. I see we have one other question about marketing directly to the patient, and if that is a part of the approach. I know we talked about the employer strategy, but if you have any kind of direct marketing in that way.
Yeah, we're definitely going to be offering direct to consumer. We already get quite a few referrals. We've just found that to target our ad dollars towards more, towards relationships that can deem long-term adoption is going to be really beneficial. But absolutely, we want it to be as readily available to absolutely everyone.
Great. Thank you so much.